The country focal point of INEE in Bangladesh, and the in-country representative of Malala Fund Bangladesh. I'd like to welcome you all to our today's webinar. You are aware that starting in August 2017, extreme violence in Rakhine state of Myanmar led to the influx of more than 800,000 Rohingya refugees who now live in 34 congested camps in Cox's Bazar districts. The likelihood that they will be able to safely return to Myanmar soon is low, given the military takeover in Myanmar from February 2021. The Forcibly Displaced Myanmar Nationals, FDMN, which is the official name of the people, or on the other name, informal name is Rohingyas. They are living in these camps, are fully dependent on humanitarian aid for everything from healthcare to education, and remain vulnerable to natural disasters such as cyclones, landslides. Rohingya children aged 3 to 14 years primarily access education at learning centers based on the Learning Competency Framework and Approach, or LCFA, that was developed by UNICEF in collaboration with education sector partners. The LCFA has filled the gap in the curriculum following the decision by the government of Bangladesh to prohibit the use of its national curriculum in the camps. The education sector's joint response plan, or JRP, aims to provide education services to more than 450,000 Rohingya refugee children and adolescents in this year, 2021. A joint multi-sector needs assessment, or MSNA, conducted by the Inter-Sector Coordination Group, ISCG, in October 2019 showed that over 86% of boys and 89% of girls aged 6 to 11 years attended non-formal education supported by organizations active in the education sector in Cox's Bazar. Learners' attendance steeply declines after age 11, especially for girls. The MSNA also shows that 54% of boys and 34% of girls aged 12 to 14 years attend learning centers. This drops drastically to 13% for boys and 2% for girls aged 15 to 18 years. There are various reasons for the declining attendance and widening gender gap in access to education services, including social norms, consideration amongst Rohingya families around the usefulness of uncertified education, and lack of available education opportunities for children over 14 years. The first case of COVID-19 was confirmed in Cox's Bazar districts on 24 March of 2020. Schools across the country have been closed since 16th March, and on 24th March, the Refugee Relief and Repatriation Commissioner closed all the learning centers, including the learning centers across the Rohingya refugee camps, which inevitably disrupted the learning of Rohingya children. To support the implementation of the COVID-19 response strategy in the camps, learning activities are supported through caregiver-led home-based learning. The caregiver-led education package covers instructions for 3 age groups, namely early childhood development, or ECD, primary, and adolescent or young adults. The caregiver-led education guidelines are available in English and Burmese language as well. Also, education sector partners developed a back to learning guidelines which outline minimum standards required for learning facilities. Once the learning centers are reopened, they will be maintaining these standards, which include maintaining social distancing, use of proper hand washing facilities, introduce a shift system to reduce overcrowding in the classrooms, requiring teachers to increase teaching time based on a shift system. To address and reduce the learning gap that is currently being created due to the COVID-related education crisis, subject-specific lesson plans have already been reviewed, and a catch-up package for LCFA levels 1 and 2 has been developed. So all these activities are being implemented throughout the COVID pandemic situation. Now, in this webinar, we have invited two of the organizations who have been involved in implementation of caregiver-led education and distance education in Rohingya camps. So, firstly, I'd invite Friendship for their presentation. Before that, I would like to share with you the housekeeping rules of this webinar. Asim, can you show the slide? Here are the webinar housekeeping rules. You can find that participant audio and video are disabled, but during the question and answer session, you will be given the access to audio. The webinar will be held in English with presentations briefly summarized in Bangla by the moderators. And post questions, you are requested to post questions using the question answer function at any time, either in English or Bangla. We can respond it. Please be informed that the session is being recorded. So I hope that none of the participants have any issues in recording. Asim? Asim? The recording and presentation of this webinar will be shared in INE's website soon. Now I'd like to invite Mr. Ruhul Kuddus, the Senior Program Manager of Friendship, to present their activities during the COVID. Ruhul.
Thank you, Mr. Musharraf Tanshan and Natalie and INE team for giving me a good chance to present in this international community. Good morning, good afternoon, good evening, everybody. This is Ruhul, as you have been informed. I'm presenting on behalf of our organization, on behalf of our education program, Friendship and Education Program. We are basically working for 4 major objectives: life savings, poverty alleviations, climate adaptations, and empowerment. Mr. Asim, next please. So before starting our main topic, just let me share a few words about Friendship. Friendship is basically a social purpose organization who is what is working for very underprivileged communities, people, and beneficiaries in Bangladesh. And it started in 2002 with a health activity This is floating hospital. It was donated by France, and right now they have, health sector has few floating hospitals who is supporting, they are supporting for various people all over the world, in Bangladesh. Friendship is basically supporting, providing their services through 6 of their sectors, programs: health, education, sustainable economic development, climate actions, inclusive citizenships, and cultural preservations. Next, please. So before starting our presentation of Rohingya responses, just would like to say a few more words about our education program. Education program is basically supporting, providing their supported through primary schools. Now we have 2 types of schools: single class primary schools and full fledged primary schools. And distance secondary education is a great component, which was started in 2015. To be mentioned, this distance education program was initiated by Mr. Mosharraf Tanshin, who is the country focal of INEE. Thank you, Mr. Tanshin Bhai. You're welcome. Just he started this initiative with great support of other educationists, other education personnel of Friendship. Thank you very much all. And adult education program, basically we are selecting the people from the chor community, from the unprivileged communities. And after a short program, most of the participants of these sessions of this event are becoming just autonomous literate. It can be just said that it's a great achievement for the people who are taking these services. EZE, empowering girls education, through empowering girls through education, is another a good component of education program. To be mentioned, it is being supported by Save the Children. We are supporting, we are covering 120 schools at Jamalpur districts. And for primary, secondary, and adult education, we are supporting, we're providing these services for Gaibandha and Kurigram districts for many upazilas. And another program is Rohingya responses, education for Rohingya children, and would say a big more about Rohingya children. Thank you. Next, please. So would like to cover just a few things about our topic. First of all, we will say about an overview, very short, and just would like to say our project overview shortly, and what we have had inclusion with apart from the sectors, UN education sectors initiative, we will say, and we will cover how we are engaging the community people and our staff during COVID-19. What types of training sessions was being conducted, was being participated by our staffs and national teachers and others. And just we will say a bit more about major challenges we have faced from the camps or during the COVID-19 situations. And just we have prepared for LCD opening. We will say a few words about LCD opening. Next, please. So camp overview already, Mr. Mosharraf Tanshin has covered many of the good things about camp. Actually, it was started, this influx was started in 2017, and the people came, the people joined an estimated community around 2 lakhs community people. There are 34 camps right now in Teknaf and Ukhia, and from this camp, 2 are registered camps, which is situated just close to Kutupalong, and other 32 are general camp. After it was just, they were started after this influx. And from the total community, around half of the population are children. And education sector, Save the Children, UNICEF, and other agencies, including Friendship, other agencies are supporting to provide education services for the children. Next, please. Okay, so let me say an overview of the project. Currently, we are running 396 learning centers. Among these 396 learning centers, 209 learning centers are our operational, and from that 209 learning centers, just 60 are being constructed. Just we have started our construction work a few months, 2.5 months before, and among this number, UNICEF is handing over UNICEF is handing over 187 learning centers to us, and as a whole, just we are providing our services to two types of community beneficiaries for learners and community people, including parents, LCMC members, community people, religious leaders, etc. So around 1,200 staffs and Rohingya teachers and host community teachers are providing our services through the people we have mentioned, through the service receivers we have mentioned above. Yes. Jim. Next, please. So what we have heard, just apart from the education sector's activities, we have first of all, we have focused to get a good monitoring among the learners, and we have segregated two types of beneficiaries. First of all, learners, and secondly, community people. We have reached during this time, we have reached them in two methods, over phone and physical communications. But in most of the cases, we couldn't be able to have a physical communications with them. But in most of the, but in many cases, we were able to make a phone call to the people, and our host community teachers, our Rohingya community teachers, and our project core staffs have made these activities successful. And from this photo, just it's viewing that one of our Rohingya community teachers is just teaching, I mean, supporting to one of our learners at his home. And like this way, our staffs, when they were able to physically reach them. They just had access, but when they were not able, they make a phone call to continue our education services. So as a whole, it can be said that just through these two methods, we have had 7,09,026 phone call and reach. I mean, total times we have reached for our beneficiaries. Yes, next please. So humanitarian education accelerator, it was conducted through a partnership with Friendship, Global Dignity, UNHCR, and AMOL Alliance. It was an excellent activity to encourage psychosocial support. I mean, to provide a psychosocial support for the primary level students. I mean, for the learning centers level students. And we have conducted these activities during these pandemic situations based on ICT. It was we provided tablets, and we have had physical exercises and group works in different ways. And after this piloting program, our children and our service receivers were delighted enough, because during the pandemic situations, they are not able to come to the learning centers with a special permission. We have had these activities with a special permission from the government. Definitely, we have made a social distancing and others. And after these activities, it can be said that it was a purposeful, and all of the participants were delighted enough, and they are just dreaming, they are just expecting to get another support from the agencies who are supporting education services for the communities. Thank you. Yes, next please. So during the COVID-19 situations, we have made awareness sessions among the community people, I have said, and we have distributed masks among the learners and among our beneficiaries, including parents, including learning center management committees. And code of ethics is our fantastic work. Best practices we are following. I mean, we are incorporating these activities through all of our services in our country. And with a great interest, with a suggestion from UNICEF, just we are planning to reincorporate this code of ethics for 250 learning centers run by other IPs, other implementing partners, for 20,000 learners. And just we are waiting, and after pandemic situations, when we are able, we will start our training sessions. We will start our reincorporation for the other IPs. Yes, next please. So tree plantation, just we would like to make our area, the camp area green, so that we have started our tree plantation launching ceremony last month. Our organizational chief, Ms. Rona Khan, she started, she launched our program, and we are planning to plant around 1,000 tree within this month, and it will be chronologically just incorporated if CIC permitted. Many of the CICs are encouraging us to just do these activities during this time, because the rain is during this rainy time. So we are just encouraged, and we are taking such like these activities to make our areas green. Yes, next please. So repair maintenance, just we have used our time properly, because of the cyclone, because of the disastrous moment, natural calamity. We have conducted repair maintenance work for 83 learning centers, and it can be said that we are able to provide a good service after reopening the schools, and all of our learning centers are ready to just welcome our children, welcome our students, learners. Thank you. Next, please. Okay, caregiver-led education. Just I am going very quickly. Caregiver-led education, just with a good objective to continue learning of Rohingya children during the pandemic situations. It's an excellent sessions. It was conducted by it was incorporated by UN education sector, and through these activities we have covered already 8,420 learners, and our teachers, our Burmese language instructors, our staffs are supporting through these activities. We are getting support from Save the Children. We are getting support from UNICEF, from education sector, and other agencies who are supporting for caregiver-led education. Just through a method, the method we have taken from the community, we have selected a few of the people, and around 3,000 we have oriented the people. 2,938 people we have oriented to ensure these activities, and our children are just continuing their services when possible through these activities. Yes, next please. So just it's being seen that there are two types of photos. In the right side, just one of our BLIs is supporting for a parent, and for one of our children, one of our learners. And in the left side, just Burmese language instructor, Rohingya community teacher is supporting for two children. Thank you. Yes, next please. Distance education through, we have initiated through EdTech solutions. Distance education, we have run through these mobile apps through interactive radio instructions, and they were basically supported by UNICEF and Save the Children. So through these activities, we have covered 8,420 learners. To be mentioned that just these 8,420 learners among 30,000, just before pandemic situations started, we have had these numbers through 149 learning centers only. And for all of our learners, we are expecting to get when LC will be reopened. And this radio program is just being broadcast by Radio NAF and Bangladesh Better, and they are supporting providing their services for grade level 1 and level 2 learners. They are just covering mathematics, English, Burmese language, etc. Yes, next please. We have increased our community people. We have made them aware. Just monthly, we have conducted monthly parents meeting, LCMC, Learning Center Management Committee meeting, and quarterly RLM, Religious Leaders meeting we have conducted. And through these activities, we were able to incorporate, to provide these services, to make the people aware. And we have conducted around more than 200 meetings. We were able, with a due permission from the concerned CIC, with a bigger objective. Because of the making awareness among the people, we have had this permission from the community, and we have made social distancing, and we have incorporated, the activities were taken place. Yes, next please. Okay, so during this time, our staffs, national teacher and Burmese language instructors have got a good scope to train themselves. So we just segregated into two types of training, internal and external training. So they have conducted, they have participated for 1,107 total number of trainings. They are trained up on PSV related issues, DRR issues, ECD issues, and classroom based management issues. They have participated for the sessions through external link and through internal link. And we have also conducted few of the internal trainings. Our staffs have also conducted for few of the trainings for our national teachers and Burmese language instructors, Rohingya community teachers. So I think that it's a good scope. It was a very nice scope for our staffs and teachers, and this learning can be applicable when LCD opening. And all of the training sessions were just based on the classroom-based management and in regard of education service providing. Yes, please. Next. So we have faced many of the challenges. First of all, we have tried to reach our learners, but many of the parents and many of the learners have no mobile phone. So it's a huge challenge. We could not be able to reach many of the parents, and physical learning activities are stopped, due to COVID-19. It affects learning outcomes, learners for education, definitely. And what we have said by Save the Children and UNICEF, we are incorporating radio program, but because of the low connection, two-week web, we could not be able to provide these services full place. And caregiver, in some cases, caregiver are not educated enough. So the objectives we are providing is not incorporated properly because of their lack of education. And we couldn't access their class just after providing the support. We couldn't be able to assess their class-wise and subject-wise learning outcomes. And new learners definitely couldn't be able to be enrolled, and they are to wait until learning center to be reopened. So it's a big challenge. And another challenge is that just in most of the cases, in many cases, we cannot find Rohingya community female teachers and qualified host community teachers to provide education services. Yes, please. Next. Thank you. Next, please. Okay. So what we have prepared, just we are ready to welcome our children to our learning centers. And every learning center is supported by hand wash places, hand wash stations, and we will ensure the minimum required gap when just the learners will come to our learning centers. Every materials would be disinfected every day, and every time we will ensure health and hygiene. We will practice health and hygiene through these activities. Regular checking and monitoring services will be provided when the children will come. It would be well conducted. Well constructed referral medical system will be activated. It will be basically incorporated by our integrated program. We have health program at Rohingya camps, so we are just trying to incorporate it. Just make an integrated program, and we will have an emergency contact person, and everything will be neat and clean. We will try our level best to keep neat and clean everything. So I'm done. Thank you very much. I do hope that I'm done within the time. Thank you.
Thank you, Rahul Kudus Ripon, for your presentation, detailed presentation. Now, I'd like to make a summary in Bangla.
Good, I think.
Tanshan bhai, I can't hear you properly. I'm sorry.
Ruhul যেই প্রেজেন্টেশনটা করেন এবং তাদের
Yes. We weren't able to hear you very well. I think connection was really bad. Maybe try again now and see if it's better.
ওকে, আমরা এতক্ষণ রুহুলের যে প্রেজেন্টেশনটা দেখলাম সেখানে তিনি আমাদেরকে ক্যাম্পের একটা ওভারভিউ দেওয়ার চেষ্টা করেছেন এবং তাদের প্রজেক্ট যেটা চলমান সেই প্রজেক্টের একটা ওভারভিউ এবং তাগুলো তারা নিয়েছেন যে কেয়ার গিভার লেড এডুকেশন এবং ডিস্টেন্স এডুকেশনের যে অ্যাক্টিভিটি গুলো তারা ইমপ্লিমেন্ট করছেন সেখানে সেইগুলোর ব্যাপারে আমাদেরকে বলেছেন এবং অন্যতম একটা দিক হচ্ছে যে কমিউনিটি এঙ্গেজমেন্ট। সেই কমিউনিটি এঙ্গেজমেন্টের জায়গাটা তিনি বেশ ভালো ফোকাস করেছেন এবং অনলাইন বেসড যে ট্রেনিং এবং টিচার ডেভেলপমেন্ট অ্যাক্টিভিটি গুলো তারা ইতিমধ্যে সম্পন্ন করেছেন সেগুলো নিয়ে তার বেশ কিছু তথ্য তিনি দেওয়ার চেষ্টা করেছেন। পাশাপাশি এই কাজগুলো করতে গিয়ে কি কি ধরনের প্রতিবন্ধকতার মুখোমুখি তারা হয়েছেন বা মেজর চ্যালেঞ্জেস কি কি সেইগুলো তারা তিনি বলার চেষ্টা করেছেন। একদম শেষের দিকে এসে তিনি লার্নিং সেন্টারগুলো রিওপেন করার ক্ষেত্রে কি ধরনের প্রিপারেশন, কি ধরনের প্রস্তুতি তারা নিয়েছেন বা কি ধরনের প্রস্তুতি তারা নিচ্ছেন সেইগুলো তিনি বলার চেষ্টা করেছেন। তো আপনাদেরকে আবারও আমি মনে করিয়ে দিতে চাই যে যদি কেউ প্রশ্ন করতে চান রুহুল কুদ্দুস রিপনের এই প্রেজেন্টেশনের উপর, আপনারা ইংলিশে অথবা বাংলায় আপনারা প্রশ্নটা করতে পারবেন আমাদের যে কোশ্চেন অ্যান্সার সেশন হবে তখন। আর এছাড়াও আপনারা যদি প্রশ্ন করতে চান চ্যাট বক্সে আপনারা আপনাদের প্রশ্ন রাখতে পারেন। Now I'd like to invite Kaisar Hassan Shourav, Manager Curriculum, Material Development and Training of Save the Children International, to present his presentation. Kaisar, over to you.
Thank you, Tanshin Bhai. I hope you can hear me nice and clean. Tanshin Bhai, can you hear me?
Yeah, please go ahead.
Okay, thank you. So welcome everybody and very good morning to all. Today we are here and we are basically here to discuss the alternative modality which we have been implementing through the last couple of years actually, because the COVID-19 scenario has forced us to give a new insight and new situation. So basically my presentation will be more focused on what we as a Save the Children initiative has done over the period of last year from March 2020 to till June 2021. So as you know that our previous speaker has already said that after from the very beginning of the Rohingya response program, Save the Children has working very closely with the education sector of Cox's Bazar and has implemented a great deal of works, especially in the education. So we are first we will be go through how Save the Children education team, education and emergency team is operating in the Rohingya context. Next slide, please. So Save the Children has basically four major roles in education and emergency. The first role is implementing through the partner NGOs, and for the education we have two partner NGOs. One is Jagran Chakra Foundation, or JCF in short, and another is IPSHA. Combining the two partner NGOs, we are operating total 100 learning center or LC, 126 community-based learning facility, 9 girl-friendly space or GFS, and we are also focusing on the host community, and for that we are also providing support to 5 government primary schools in Ukhian. That's the first role of implementing through SC. The second role is provide the technical support to the education sector through the teachers' professional development. And as you know, the Save the Children is working on the well-being of the learners, and the learners are the best served by education. So as the education is being provided directly by the teacher, unfortunately, those who work here know that most of the teachers who are working here have a major challenge, specifically for their level of formal education, and also the lack of their previous experience. So Save the Children is working actively to support the whole education sector in all 34 camps uh, through the Teachers Professional Development Framework. Number 3 is the distance education modality for sector. This modality was specifically designed and during the COVID-19, and our previous speaker has also mentioned it, the distance education modality, and we will go through in the later part of the presentation. And the last part is Save the Children is working as the co-lead of the Cox's Bazar education sector, and beside the co-lead of Cox's Bazar education sector, it has also have the strong presence in many other working group in Cox's Bazar education sector, like Save the Children is also the standing chair of the technical working group of the Cox's Bazar education sector. Also, you know, the Myanmar curriculum is coming, so it is also the working member of Myanmar curriculum, the GIHA, and many other working groups. So these are the 4 major role Save the Children is currently playing in the emergency context, that is the Rohingya context. Thank you. For the next slide, please. So in a nutshell, we are having currently we are serving to reach total 10 million 2,304 stakeholders. Among them, 9,019 are girls, 6,981 are boys. These are the children, and 45,597 are adults, female, and 40,707 are adult male. Next slide, please. As you know, from the 17th March, the education service has been declared as a non-essential service inside the camp by the RRC, and the RRC is the government entity who is responsible to regulate the total Rohingya crisis situation in Cox's Bazar. During from the very initial period of 17 March till the September, a very hard lockdown was initiated, and during that time, the movement and restriction were so hard that the people, the teachers, and the learners were facing difficulty to move around. So it was somewhat very much challenging to initiate the education program or continue the education program. But after September 2020, the lockdown was somewhat released and became a more flexible. And during that time, a lots of alternative initiative was actually started to taken place. The learnings and in that time, the learning session was also initiated the first week of April 2020, because and that learning session was followed by the caregiver-led education, which was suggested by and approved by the Cox's Bazar education sector. Continuation of the regular activities like CEC member, parenting session, teacher training. This was also became more diverse and has come to in short group basically from the 1st January 2020, and the continuation of the caregiver-led education is still ongoing because as you know that the learning centers or any other center was not, any other learning facility was not cleared to reopen. From the 23rd April of 2021, the all kind of face-to-face intervention stopped again due to the high surge of COVID inside the camp. And unfortunately, as you have already heard by now, that what the yesterday news, national news was saying, that from the Monday, that means day after tomorrow, a more a very more hard lockdown is going to implement, and which is being called shutdown, and I think it will again bring some more challenges. Next slide, please. And also online based training for partner staff and teachers. Thank you. It will be discussed in the later. Next slide. Okay, during the COVID-19 outbreak, during the COVID-19 outbreak, a major focus were given to the capacity building initiative. A 5 days long duty on basic teacher training for the partner staff were provided. Also, a 3 days duty on the subject-based teacher training for the partner staff was provided. All the teachers, all 266 teachers were provided the PFA or psychological first aid training by our MHPSS coordinator. 6 days basic teachers training for all the teachers were initiated, because we were very much concerned that due to the extended lockdown, the teachers might have slept, or it will be challenging after the reopening of the school. So all the teachers, including new and old, were given the basic teachers training again, just to ensure that they have the capacity and skills necessary for providing the quality education they are supposed to do after the reopening of the school. And also complete the 4 days long subject-based training for 266 teachers. And this subject-based training where the was focused on the second quarter of the GIEP curriculum, which was a very new curriculum at the moment. Now, next slide, please. So now we are going to discuss how our modality was done in the COVID-19 outbreak. First, one of the learning center modality was placed was the learning center based. We have 100 learning center, and through this 100 learning center, we are covering 10,555 children. But as the RRC has stated that education is non-essential service, and all the learning facility around the country is forced to be closed. So what we did was that we have established 746 learning points, and each learning points each learning points were consist of 3 to 5 children who came at a specific day, time and date of a week, and teachers will go there, and in that specific point, using the social distance and other necessary precautions, teacher discuss their learning and track their learning. Because when we were implementing the caregiver-led education, which was prescribed by the education sector, it has been found that most of our caregivers, which are the in many cases parents, and also the other guardians, were not have the necessary skills. Because they don't have the necessary skills, it was very difficult for them to guide the children or the learner to day-to-day work, or provide the necessary learning support. So these additional learning points were very much helpful for the children. And through these 746 learning points, we ensured that each children will get in touch with the learners for at least 2 days in a week. Next slide, please. And also during this period of time, we will we distributed all the learners the hygiene kit, the dignity kit to 1320 kits, especially for the adolescent girls, and the facilitators kit to 266 teachers, which is the total number of our teachers, so that the teachers can move around with the necessary learning materials. There are some pictures of distribution of the materials. Next slide, please. The second alternative modality, which we have been developed during this period and has been praised highly by both the community, the local government, which is CIC, and also our donors, is that the PP or peer education program. So in this modality, we have established 150 peer education group. And in this peer education group, initially the first cohort was initiated by the 50 peer education group with 150 adolescents girls. Each group were consist of 3 adolescent girls and 1 peer facilitator. This peer facilitator was actually one of the adolescent girls who are currently enrolled in the regular learning facility, but in a higher grade. And through them, it was very much helpful for us to reach the adolescent girls who are not willing to enroll in the regular learning facility. And this peer facilitator girl were facilitate the learning program to the each group. And to help the peer facilitator, we have 10 national and 10 refugee community supervisor. There are program organizer, technical officers, and project coordinators as well. Next slide, please. For this PAP, we have already completed first and second cohort of the modality, and each cohort is consists of 6 months. And during this cohorts, the continuous teacher training, CC meetings, and parenting session was done, and it was given approval by the CIC, and the approval was taken before the each activity. Distribution of the material was also ongoing as well. What after the second cohort, each cohort we take the feedback and we take some assessment how the program is ongoing, and what it has been suggested that parents and the communities are very much appreciated of this program, mainly because of the 2 reasons. One is this program, all the learners are girls, adolescents girls, and as the facilitators are also came to the convenient place, and the facilitator herself is a girl, they feel more easier to continue their education. 99% peer learners has showed the improved knowledge on their learning development and well-being, because after each cohort we take the endline survey to measure their improvement. The involvement of SEL, life skill, and MHPSS has impacted the behaviors of 98% children positively, because the lockdown has created so much mental pressure all around the world. The positive impact of the program has successfully kept up, and the same learner in every cohort. So each learner is going a little bit more learning capacity and competency after finishing the competency. Finally, some of the graduate learners got opportunity as a facilitator. So this is one of the main, also very important motivational thing for the learner, because they can see how the peer facilitators are gaining more and more prestige from the community, and they are gaining the respect from the communities as being a teacher. So it has also give the learners a positive boost for taking their learning very seriously. Next slide, please. So the other program was the community-based learning facility, and for with that with the 126 learning facility, we are covering 2,750 learners. And for supporting these learners, we have 65 host teachers and 128 Rohingya teacher. Actually, one host teacher is supporting two Rohingya teachers, but each learning facility is being supported by the one Rohingya teachers. The material distribution has already been done, and you can see where this program is being covered through 9 camps. Next slide. And for this initiative, CBLF initiative, we have also made some small groups so that our learner can can continue their learning. And total 630 learning points or small group has been made to cover all the 27 nearly 2,700 learners. And you can see some of the picture of our activity during the COVID-19. Next slide, please. What we were done, yes, is that mental health and psychosocial support is one of the key aspects in education for Save the Children. And as you already know that after the COVID-19 scenario, it has been gaining more and more attention worldwide. So what we are currently doing is that we have some packages for training like remote pedagogical first aid, social emotional learning, self-care, stress management. And we are continuously training to all the partner staff, teachers, and peer facilitators. And there are 172 master trainers from education sectors who are supposed to cover all the 34 camps. And we have already trained all the 172 master trainers. And there is a MHPSS coordinator among us also who are responsible to oversee all of the activity during this. And we have also continuously take the online session with them. Next slide, please. As we were saying at the very beginning, the teachers' professional development has ongoing, and currently it's being provided through Save the Children to the education sector, and all for the teachers' professional development. 172 master trainer has been identified, covering all the partner NGOs of the education sector, and also 1,000 resource teacher has been selected, and they will be given training by the master trainers to roll out the teachers professional development, so that all nearly there are 5,000 teachers in camp area. So they will be covering by this modality. Thank you. Next slide, please. For the teachers professional development, there are some pre-COVID scenario. Like pre-COVID, we have developed the teachers capacity competency framework and the TOT modules. But after the first wave, the TPT program was somewhat being paused for a time being. But very soon we have been able to fast forward it, and during that time, during the second wave of the COVID especially, we have been able to continue our TPT framework through online platform as well. And currently what we have done that we have we have provided all the training to our master trainer, and subject-based training module has been done by the math, science, and English. The Burmese version is currently undergoing. And also one of the key things is that the teacher learning cycle guideline is currently under review by the TPD framework, and hopefully it will be dispersed soon for all the education partner in Cox's Bazar. Thank you. And next slide. Yes, and one of our key and most attractive and awarded program during the COVID-19 was the distance education program, where the target was 75,419 children with 93,000 households across 34 camps were to reached. So 72 interactive radio instruction session in math, English, and social emotional learning were developed, and airing and re-airing of 72 sessions through community radios. The radio community radios are the Radio NAF and Radio Bangladesh Betar Cox's Bazar. Complimentary messages for parents and caregivers through IRA session was also being provided. Next slide, please. We'll learn some more on the distance education. And for the distance education, 2,000 post teachers and 172 master trainers were briefed, and 175 e-learning courses in math, English, cell, and remote pedagogy in ECW LMS app were also developed. And for this distance education, what we need to also know that an LMS app was developed, which is Learning Management System application. And through this application, we can monitor how the teachers and other practitioners are currently being engaged with the e-learning courses, and there are some interactive features like quizzes, classes, and also the digital MIS system were also in there. So with this distance education, we take a big jump to the digitalization in the camp context. So to make it successful, 12 field level orientation sessions with partner staff were done, 2 workshops with remote supervisors were facilitated, and monthly mobile internet package for teachers and MT were also provided by the distance education team. Some of our partner were facing some challenges for the as we have been conducting lots of Zoom meetings, and they also need to done this with their own staff and teachers. So we also make sure 10 business license for Zoom and provided that to our partners. Next, please. After airing the 72 sessions, we again reair the 50 IRI session has, especially during the COVID second wave and lockdown. Total 102,265 students, almost 49,248 are female, have listened to the IRI session according to the Education Sector 5W report. Which is 35% higher than projected beneficiary target. So you can see that how much appreciated the target, how much appreciated this modality was across the sector also. Effective assessment of IRI session was conducted across 12 camps during the program, and it has been found that 86% of the learners who are attending this modality are our average rates are in A grade. So it is also very much encouraging to us that children and learners are also become used to, and they are also getting it enlightening to them. 7 online orientation have been conducted with the partners, focal teachers, and MT on LMS quizzes and live classes considering the COVID second wave. And you can see one of the live orientation, online orientation sessions where our distance education team were facilitating how the LMS platform can be used. Thank you. Next slide, please. So we are almost at the end of our presentation. For the school reopening, we are currently maintaining all our learning center and all kind of learning facility very properly, so that within hours notice we can reopen any kind of learning facility. We have also prepared a school reopening action plan following the government rule and also the Bazar education sector guidance note. LC reopening assessment has been already completed with the learners. All teaching learning material has been procured and distributed. Community awareness were done through parenting session and CC meeting, and also the teachers are trained on MHPSS and pedagogy, because we are very much concerned then after such a long time when the school will be reopened, our learner will get some kind of PFA support. So the teachers are also being trained, specifically focused on that action. And next slide, please. So here reading this, these are some of the pictures during this January, February, where the lockdown were partially flexible. Lots of visitors from national and international visits were done. So just to overlook how the centers were being prepared and maintained, and also have lots of focus group discussions with the teachers, the teachers and community members. So that is all from me. Thank you for listening with such patience. And now I'm open to all for any questions or further clarification. Thank you. Back to you, Kanchan.
Thank you, Kaisar Hassan Shourov, for your nice presentation, detailed presentation, I must say. So now I'm going to summarize Kaisar's presentation in Bangla, particularly Save the Children হচ্ছে এডুকেশন সেক্টরের co-lead, ইউনিসেফের সাথে গ্লোবালি সেভ দ্য চিলড্রেন co-lead হিসেবে কাজ করছে, সেটা এডুকেশন ক্লাস্টার হোক বা এডুকেশন সেক্টর হোক। এবং এই এডুকেশন ইন এমার্জেন্সিজ এর ক্ষেত্রে কক্সবাজারের ক্ষেত্রে তারা গত যেই কোভিড প্যান্ডেমিক সিচুয়েশনে যেই কাজগুলো করেছেন সেগুলোকে মেজর তিনটা রোলে আমরা দেখতে পেয়েছি এই প্রেজেন্টেশনে। একটা হচ্ছে যে পার্টনার এনজিওর মাধ্যমে ইমপ্লিমেন্টেশন, তাদের পার্টনারিং অর্গানাইজেশন হচ্ছে যে জাগরণী চক্র ফাউন্ডেশন এবং ইপসা। এবং সেভ দ্য চিলড্রেন আরেকটা কাজ যেটা করছে সেটা হচ্ছে যে টেকনিক্যাল রোল প্লে করা। কক্সবাজার এডুকেশন সেক্টরের পার্টিকুলারলি টিচার প্রফেশনাল ডেভেলপমেন্ট, এই জায়গাটাই সেভ দ্য চিলড্রেন একটা টেকনিক্যাল রোল প্লে করছে। তারা টিচার্স কম্পিটেন্সি ফ্রেমওয়ার্ক তৈরির ক্ষেত্রে নেতৃত্ব দিয়েছেন এবং সেটাকে ইমপ্লিমেন্ট করা এবং সেইটাকে কিভাবে বাস্তবায়নের দোরগোড়ায় নিয়ে যাওয়া যায় সেই জায়গাটাই সেভ দ্য চিলড্রেন কাজ করছে। এবং এই কোভিড সিচুয়েশনের ক্ষেত্রে আমরা দেখতে পেয়েছি সেভ দ্য চিলড্রেন ডিস্টেন্স এডুকেশন মডালিটিটাকে এনহান্স করার জন্য এবং ডিস্টেন্স এডুকেশন বা দূরশিক্ষণ প্রক্রিয়াটাকে তারা এগিয়ে নিয়ে যাওয়ার জন্য বেশ কিছু কাজ করেছেন, যেটা এডুকেশন ক্যানট ওয়েট ফান্ডের সহায়তায়। তো আমাদের কাইসার হাসান সৌরভের প্রেজেন্টেশনে আমরা এই জিনিসগুলোর একটা প্রতিফলন দেখতে পেয়েছি। আমার কাছে যেটা মনে হয়েছে যে কাইসারের প্রেজেন্টেশনে আরেকটা জিনিস আসতে পারতো, যে কি ধরনের চ্যালেঞ্জ তারা ফেস করছেন এই জায়গাগুলো ইমপ্লিমেন্ট করতে গিয়ে। তো আমি একটা প্রশ্ন রাখবো কাইসারের কাছে, যে তিনি যদি প্রশ্নোত্তর পর্বে এসে দু একটা চ্যালেঞ্জের কথা বলেন, মেজর চ্যালেঞ্জের কথা বলেন। আমরা ইতিমধ্যে দেখতে পেয়েছি অনেকগুলো কোশ্চেন চলে এসছে আমাদের কাছে। we notice that there are a lot of questions in the question answer section of this webinar. We have found Susan Durston. Susan has given thanks to the for initiating this interesting and challenging initiative, and congratulates for that. He has a question like, what preschool or getting ready for school programs exist? Is there a child-to-child program? If anyone, Kaisar or Ruhul, can answer, is there any child-to-child program in friendships program or Save the Children's program?
Tanshin bhai, may I come in?
Yeah, sure.
Okay. For our peer-to-peer facilitation program, which is we call it PP program. This is being based on that modality because the peer facilitators, she is actually an adolescent. So for the broader aspects, yeah, she can, most of the cases she's below 18, so we can say this is a child-to-child program, and we have found that this peer facilitation or providing by a peer learner is being very much effective and interesting for our learners. So yeah, we have that program.
Yeah, thank you. Ruhul, would you like to say something on that question?
Tanshin bhai, I'm so sorry to mention. Would you repeat the question, please? Because of the internet connection, low connection, just poor connection, I couldn't be able to hear your question properly. But I have,
Okay. Yeah.
Yes, please.
Particularly, Susan's question was, what preschool or getting ready for school programs exist? Is there a child-to-child program?
So the answer is perfect from Saurabh bhai, because just we have incorporated the leveling. I mean, level 1, level 2, and level 3, level 4. Except this one, just we are now going for MCP, Myanmar Curriculum Piloting, but all of them are following by level. Okay, so Myanmar are just following for secondary level. So other than these ones, we are not following any other method, like Saurabh bhai said. Just we are following the method. Yes, thank you. Over.
Okay, particularly, yeah, Saurabh's answer is perfect. There is a question from Subbo Fatima, who is attending from Pakistan. This particular question is to Saurabh. How were you able to translate the curriculum which we normally follow in the classrooms with learning objectives in the learning center model? Was it expedited or is there any framework for learning center model that you followed? What were the subjects that the learning centers were able to implement during this time?
Thank you, Tanshin bhai, and thank you, Ms. Fatma, as well. Actually, very nice and interesting question. So what I would like to say is that yes, there are four subjects in currently we are being able to taught in the learning center because yeah, as there are actually lots of questions in your part. I just give you a brief, only a 1 minute summary. Is that Bangladesh government has allowed a specific curriculum for conducting the Rohingya children, and this curriculum is neither currently neither similar to Myanmar nor with Bangladesh curriculum. So what the education sector had to initiate is that to initially they have made a they have considered the competency for which was provided by the Myanmar education and Bangladesh government education as well with the UNICEF global education competency. So combining all three competency, a different framework was established at the very beginning, and this was around at the time of 2017 and 18, because Bangladesh government did not uh, gave the permission to roll out Bangladesh curriculum in the camp context. So 4 subjects were given the permission to implement for level 1 and level 2, because we have to, as you might know, that all the learning center based education program are divided into 4 levels of education, which is level 1, level 2, level 3, and level 4. Level 1 and level 2 has 4 subjects, and the 4 subjects are English, math, life skill, and Burmese. And for level 3 and level 4, there are 4 subjects, 5 subjects. With the 4 subjects from level 1 and 2, there is also the science. And the level was level was covering such a way that level was is equivalent to grade 1, which is a 1-year course. Level 2 is equivalent to grade 2, which is a 1-year course also. But level 3 is equivalent to level grade 3, 4, and 5. Combining all 3 competencies, level 3 was made, and this is a 2-year course. And level 4 is a combination of grade 6, 7, and 8 competency, and this is a combination. This is also a 2-year course. So what the center model learning objective or the center model is that we have all the partner of the education sector has followed the INE model, and also the model has been approved by the education sector and the ISCG, the Intersectoral Coordination Group in based in Cox's Bazar and globally. So with that in mind, we have the specific curriculum or guideline, which is currently being called is GIEP in short, which is the Guideline for Informal Education Program, is currently being implemented. So all the education sector, especially who are implementing in the learning center model. Hope I have addressed your question. Thank you.
Thank you, Saurav. There was another question from Cho Le Mar, where he was asking for to Ruhul, which language do the Rohingya teachers and host community teachers use for the teaching? Do they have same language? Ruhul.
Thank you, Tanshin Bhai. Actually, I have answered the questions through writing. Okay,
but
repeat.
I think
Yes,
you can repeat
yes.
for the all
Thank you. Yes.
participants.
Yes, got it. So yeah, we are just providing our services into 2 language, English and Burmese. So the Burmese language instructor basically is supporting a great role to provide education services through Burmese language, and vis-a-vis host community research is basically supporting through English language. But in some of the cases, both of the people are supporting others to deliver the mathematics, English, and subject-based learning. And in many cases, the Burmese language is similar to our Cox's Bazar language, I mean local language, local dialect. So it's easier for us, for our host community teachers to deliver their facilities. Okay. Yes,
Okay.
I hope
yeah.
it's done. Yes, thank you.
Thank you. Cho was also curious to know about the numbers of female Rohingya teachers.
So it's an interesting question. Actually, to be very frank, we have a very less number of Rohingya teachers, Rohingya community female teachers. We have started our activities in 2018, and after starting our activities, we searched for the female teachers, but in many of the camps we could not be able to search. I mean, many of the Rohingya teachers, but the actors who started from the very beginning with education, I mean in 2017, they have a few more Rohingya teachers. And the big reason for this, the big challenge, just we have read out from the community that many of the community people are reluctant to send their female person out of their home. And this is not only for challenge for the teaching, I mean for the teachers in regard of the teachers, but also this is a big challenge for our learners as well. I mean above 10 years old learners in many of the families are not allowing them to go out of their home. But through an intense communications, we are trying our level best to minimize this challenge. Especially we are taking, I mean, we are communicating the religious leaders, and we are making them understand that you should, I mean, it's they should go home, they should go out of their home, out of their residence. And we are just making the awareness through mazis, through head mazis and sub block mazis. And especially just making a good awareness, we are trying to remove this idea they have I mean, their thought, their religious thought from the community. Thank you.
Thank you. There is another question from May Tan to Kaiser. In caregivers-led learning, how are the caregivers selected? What are the criteria? And Metan has also a supplementary question, like to Kaiser again. You mentioned that some caregivers lack education. How did you address this challenge?
Thank you for the question. For the caregiver-led education, actually, no learner has been selected specifically for the caregiver-led education. It is basically a modality. After the learning centers or learning facility was shut down for the COVID pandemic, the modality which we were going through was called the caregiver-led education. For just to give you a glimpse of the modality, for the learner of that modality were the children who are currently enrolled in the learning centers. So what we have done to follow that modality was that first the education sector has identified some of the specific lessons for initially for a month, so that the lesson were selected such a way that from a very limited instruction or with a very limited guidance, the learner can go through the workbook or their working sheet with themselves. So the Rohingya teachers who resides inside the camp, and most of the learners are live just near or in the same road or area. The teachers were supposed to visit each learner to their residence, and during that visit, he or she will have to go through the work done by the learners, and also the Rohingya teachers will give the guidance to the caregiver. The caregiver were defined as the person or guardian who are supposed to look after the learner, and the teachers were just gave the guidance what the next few days or next 2 or 3 days the learners will be going to the during the period before the teachers come again. So as I said at the beginning, is that the lessons or the activity was being carefully selected by the technical persons of the education sector, so that the session were being the work homework or there are some workbooks. So with a very limited guidance, the learner can go through the workbook also. And for the second part of your question, it's just that to be very honest with you, is that we are still facing because there are no specific modality for increasing the uh, uh, literacy or competency for the caregiver or the parents. So the problem is still there. But what we take is that there are we take lots of different ways, because like that we find some of our caregiver or parents do not even know how to read or write. So what our teachers had just do that is that he or she, when during the visit of that program, he or she just make a small folding of the pages, 2 or 3 pages specifically, which pages of the which of the pages the learner will go through in the next few days, and give the instruction to the parents that okay, from this folding page you will give this page to the next day and give this page to the second next day, like that, so that the caregiver can at least spend some time covering the study time with the learner.
Okay, thank you.
There
There is,
Bhai, may I add? Yes. May I add?
I think we are running short of time, so there are some more questions. I think we can go
just
for
to
other
for
questions.
criteria. Yes.
Yeah.
Okay.
Particularly, Nguyesia Theory Ulrich has a question. I'd like to know how the assessment of learning outcomes were done. Ruhul, would you shed some light on this?
Yes. Thank you. Actually, this is tough to assess the learners learning outcomes from the modality we are following from the camp context right now, especially if we think about the host community. The people anyhow can go here and there, but in the camp, most of the time host community people are not allowed to access, to get access for the camps. So what we have done assessment through our Rohingya community teachers, and we have followed a template provided by UN education sector, and through this assessment, after collecting our result, just we have submitted it to Save the Children, to sector, Mr. Ashish. So we have just followed this template. So other than this template, we have no any other method. But we are thinking how to enhance this assessment process, but it depends on the situation, COVID-19 situation. Thank you. Over.
Sure, thank you. There is another question for Kausar from Imtiaz Ridoy Street Child. Do you have any further plan to reach out Rohingya adolescents with this distance learning module during this pandemic? Question 2, what kind of pedagogy you have trained to teachers on?
Okay, I'm going. I will go quickly. Is that first we are yes, we are very much keen to reach out and cover a greater adolescent group, especially with the distance learning module. Unfortunately, it will depend on the availability of the fund. Like majority of the work that has been done in the camp context. But yes, we are hoping to cover that, and also what we have already done, that we have made some of our modality and our learnings has already been shared with the partners in the camp context, so that if any other partner can follow, or can if any other partner wants to follow the modality which we have been followed, they can also do it. For the second part of the question, what kind of pedagogy we have been training of the teachers, the part has been basically for the basic training parts, like the education, varieties of educational concepts, with the focus of education in emergency, and also the learning competencies, teaching objectives, learning environment, teaching material, how to conduct effectively, focusing on the camp context, psychological first aid, disaster risk management, and also with varieties of content and many pedagogical approaches, like the teaching learning methods with child psychology in it. Hope I answered.
Thank you. There is a question from Shakila Yasmin of BRAC. She asked to both the presenters, have you done any evaluation of your programs? If yes, what is the modality for data collection? Rule, would you answer?
Thank you for the questions. Actually, we haven't done any other evaluation, but just assessment. We have just had an assessment, what I have said. So except this one, we haven't done any other evaluation, but we are planning for an evaluation and we are working on that. Thank you.
Yeah, I think this is the same regarding the Save the Children, isn't it, Saurav?
Uh, Hi, almost, but there is a different aspect because we were able to take some of the assessment, especially in the January, February, March time, because at that time the restriction were a little flexible, and during that time we have gathered lots of assessment, and for the distance education, a test was being conducted by the Rohingya teachers, and that test were developed. There were 15 items were present in the test questionnaires, and through that the learning competencies were assessed, and also like for the endline survey of the PP program, each cohort, the endline survey questionnaire was being developed, and through our monitoring and learning team, and also the partners team, a detailed endline survey were being made, which properly documents the progress of each learner through a certain period of time. So, fortunately, using the window frame of the flexible timesheet during this January, February, March, we were able to do some of the assessment during that time. Thank you.
Thank you. We are running out of time. Already it's 1 p.m. So I'm going to pose the last question from Shukufe Rahman. It's to Kaisar again. She has a question regarding PD program, professional development of teachers. Is that master teachers or master trainers from Rohingya community or host community? Is there any master trainers from Rohingya community or host community?
Okay, thank you. All the master trainers are the staff from the different organizations, as the Rohingya community cannot be recruited as the organizational staff. So naturally, all the master trainers are the host community, and they are the employees from the different organizations, specifically the technical of the technical officers. Most of them are the technical officers of the different organizations.
Okay, thank you. On this note, we would like to conclude. Particularly, I would like to thank both the presenters for their nice presentation, nice and detailed presentation on the Rohingya children's education during the COVID-19 situation. And I would also like to thank you all for participating in this webinar. I would extend my thank and gratitude to Natalie Eckstein, the coordinator of INEE Secretariat. And I'd like to thank Asim Latif, who was responsible for sharing the screen today. We also would like to thank Brooke, Ms. Brooke, who was providing us with the closed captions. And I would also like to thank Mohammad Ramjan Ali, Tahmina Sonia, and Ishrat Jahan Shumi, who were in the planning process and organizing process of this webinar. And also, I'd like to all you for making your time to participate in this webinar. I would also like to make an announcement that we are planning to have another webinar on education in emergencies in practices in Bangladesh. Particularly, this next webinar will be focusing on the education in emergencies practices regarding the natural disasters like flood, cyclone, which have been practiced throughout the country for last 1 or 2 decades. So we are hoping to organize that webinar by July 2021. I would also like to invite you all for that webinar as well to participate, and also express of interest for presenting your programs if there is any. So on this note, I'd like to thank you all again and conclude the webinar. Thank you all.
Thank you.
Thank you, Tanshin Bhai, for initiating these webinars.
Thank you, Natalie, Osim,
Welcome.
Dhruv,
Thank you very much, everybody. You're welcome.
Duhul and Shaurav.
Thank you, Musharraf. Take care.
Thank you, Kanchan Bhai.
Thanks. Have a great day.
Have a great day, Natalie.
Thank you.
Rule Bhai looking fresh.